Welcome to Connectedness 101. Thank you for joining us at the American College of Lifestyle Medicine series on the 6 pillars of lifestyle medicine. I am Dr. Gia Merlot, clinical professor of psychiatry at NYU Grossman School of Medicine in New York, and I will be joined by Dr. Steve Sugden. We are going to go through Connectedness 101. We're really excited to present this information to you today. As we know, and as you've been going through all of the pillars of lifestyle medicine, we know that these are all great concepts that have not taken hold in society. Everybody knows we should be eating well, exercising, sleeping well, and decreasing our stress. But why are we not doing it, and why haven't they taken hold? Well, that's really important, and I think it's especially important for this pillar. So just to give a little bit more in-depth introduction to myself. This is who I am. I am a clinical professor of psychiatry. I'm the associate editor of the American Journal of Lifestyle Medicine. As of May 20th, I'm treasurer of the American Psychiatric Association, fellow of the American College of Lifestyle Medicine, distinguished fellow of the American Psychiatric Association, and founding chair of the Lifestyle Psychiatry Caucus of the American Psychiatric Association. So I will be presenting with Dr. Sugden, and he will take it from here.
Thank you very much for that introduction, Dr. Merlot. My name is Steve Sugden. As was mentioned, I'm currently an adjunct professor at the Uniformed Services University, as well as an associate professor of psychiatry at the University of Utah School of Medicine. Likewise, I'm also a fellow of the American College of Lifestyle Medicine, a distinguished fellow of the American Psychiatric Association, and also a fellow of the American Society of Addiction Medicine. So, to start off with this discussion of lifestyle, of connectedness, we thought it would be important to read how lifestyle medicine defines connectedness. And they say it is a strengthening and maintaining relationships and connections that foster meaning, purpose, emotional well-being in life, and may include connectedness to family, friends, community, as well as nature, pets, or individual spiritual beliefs. And we really like how this is the new definition, as it increases this idea of just social connections. But when we were thinking about this, we think that there's even more to this. And for the remainder of the presentation, we would like to talk about our ideas of connectedness and see how this lands with everybody. So we published this in a paper that came out last year. It was the Connectedness, the unupdated and expanded pillar of lifestyle medicine and psychiatry. It was an article that was in the American College of Lifestyle Medicine. And so anything that we might say, if you have questions, this is a great article that has a lot of our figures that we're going to be using today to be able to discuss this. So key within this is we created this model, and we're calling it the Merlot model of connectedness. And there are 3 core relationships which we're going to be discussing here in the next few minutes. The first one is a connectedness or a connection to oneself. The second one is connection to others. And then the third one is connectedness or connection to the world. And within this, we have 6 domains. And we have arbitrarily linked happiness and purpose in life and meaning making as domains that help us with this connection that we have with ourselves. Empathy and compassion and social connection helps us with this relationship or connection to others. And finally, nature and spirituality and religion helps us with this connection in the world. In this diagram, we realize that these connections to self, others, and the world really are a full circle. And many of these things, for example, purpose in life and meaning making, can help one with a relationship with themselves, but it can also impact their connectedness with others as well as the world. And so even though we've put it out as this, for simplicity's sake, for this model, it does not represent the the interconnectedness that these domains have with these core values or these core relationships that we have. So we will now focus on these core psychological relationships that we have. And the first one, and it is important to remember, this is a great um, diagram that came out of the Office of the Surgeon General's recent article about the epidemic of loneliness and isolation. And in this, the Surgeon General talks about to establish relationship, there are three core pillars or functions or components that are vital for each relationship. And that is we must have a structure, we must have function, and we must have quality. And as we talk about these relationships or connections to self, connection to others, and connection to the world, please have in mind that to improve these or to strengthen these, we must have structure, we must have function, and we must have quality. That we can't have these improvements of these relationships if we're not actively developing the structure, function, and quality. And really, we'll talk more about how the domains help or facilitate that. So what is connectedness to self? Well, many times, we think about a relationship or connectedness to ourself. Um, is we can't have healthy relationships with other people if at first we don't have a healthy relationship with ourselves. And this is different than this idea of a narcissistic personality disorder where all I do is love myself and I think myself is greater than other people. What we're suggesting is not that, because many times people who have that narcissistic relationship actually lack self-worth. They really lack this healthy relationship that they have with ourselves, with the perceptions of others, with others, and such. And so to really develop this, when without this connectedness or relationship to ourselves, this really can foster these feelings of inadequacy, feelings of unworthiness. Oftentimes we have increased sadness, hopelessness, and anxiety. So many times people go with this underlying feelings that they are failures, that nobody can love them, that they don't provide any good. And when they have this lack of self-worth, it really frustrates or really impedes their ability to pursue goals, because they really feel this sense of failure, or whatever they do, that they're going to have this overall sense of failure within their lives. Frequently we hear this about this idea of being an imposter, that people will catch them for that they really don't have that underlying quality. And again, this really drives home this idea of, this drives more inadequacy, unworthiness, unhappiness, hopelessness, and anxiety. So when we think about connectedness to others, it's interesting to consider this theory called the disengagement theory. And this came out in the 1960s. And the thought was, as generations get older, they will engage more from their social life. And then so the 1960s, they were looking at the silent generation, and they were starting to see that many individuals in this relationship, in this phase of their lives, were just starting to engage less. They were concerned more about their own well-being and such. Well, what the authors of the disengagement theory did not suspect is that when you look at the silent generation versus the baby boomers versus Generation X versus millennials versus Gen Z, each generation has become subsequently more disengaged with their communities. They have more distrust towards other people. They have fewer people that they call their lifetime's friends. There's increasing frustrations that their communities are no longer competent. And the fear is, not only are the younger, with each passing generation or each passing year, more and more, just from being in this kind of reality, we really are having more and more challenges being connected with others. And because of this, we really feel that our communities are not doing what they're supposed to do. We struggle to develop a sense of belonging. We struggle to integrate with that social fabric where we can utilize the resources of other people. We can have these healthy relationships. We fail to contribute to our surroundings and realize that our individual efforts are needed and important within our social communities. And by doing this, we can actually help improve the life of everybody involved. But by not engaging, there's a lot of people who are suffering because of our inabilities or of not being able to connect to people at this time. And finally, this then brings us to that third level of connections, and that's with the world. And there's this idea called cultural erosion, and more, whether it's due to social influencers, political leaders, this perceived sense of scarcity, or a zero-sum games where there's only X amount of resources, and if somebody gets this resources, then somebody else doesn't. People are disengaging with this greater sense of the world around them. This noise that we're calling it is then being further amplified through urbanization, migrations, and globalizations. We're appreciating individual communities, but each individual community is getting absorbed into this mass cultural identity, and it makes it harder for people to engage with this sense of world. And this then leads us to that idea of social erosion, where the loss of social capital and a fracture of social networks negatively impact social stability, individual well-being, and the economic productivity as a result of persistent public anger, distrust, decisiveness, lack of empathy, marginalization of minorities, political polarization, essentially. And because of this, we're seeing greater communities where they have this sense of disconnection, sense of loss, grief, emptiness, and worthing mental health. And really, it's, although we've been trying to identify, an isolation of self, others, and the world as individual, really there's as we really demonstrated with our model, these are circular, and these relationships are all interconnected.
Great. Thank you, Dr. Stockton. What a great overview of the outer ring of this model. And when we're thinking about it, as Dr. Stockton was mentioning, this is really important because if we get into this concept of only including social connection when we think about connectedness, we're missing major pieces of it. For example, you may have a patient or a client who is not able to adhere to your recommendations or your prescriptions that you're giving them, but they really have the motivation and they really want to do it. So maybe what they really need to address is more self-empathy and self-compassion. And through that, they may be able to then be able to engage in your prescriptions. And sometimes we have patients that actually maybe need, more in the spirituality and religion. This is something they believe in and it's something they want to integrate, but that's what they're lacking because they tell you, for the first 20 years of my life, I was going to church every week and now I haven't been in 20 years. So maybe that's the level of connection that they're missing in their life. And with that, they may be able to develop in all of these other pillars of lifestyle medicine that we're talking about. So as Dr. Sugden mentioned, the inner circle is of the 6 domains, and I'm going to go through them one by one, give a little bit of the science behind it. And the reason that's really important is because lifestyle medicine and lifestyle psychiatry is an evidence-based field. And we know this. And we know that when we're talking about it with our patients, we need to be able to say, I'm not telling you that you need to focus on this because I just think it's my issue or my bias. There's evidence behind it. And that's really where, when we can point to that, then we're really helping our patients potentially engage in this process. So let's first look at happiness. So when we talk about happiness, we know that it's defined differently across different cultures and time period. And we're not just talking about happiness, which is our state of being happy. We're talking about that state of happiness, which is really important to understand the distinction. It's not either or, it's both. And we know that it's tied to so many different cultural aspects. It is not just about a feeling of the social network or how we feel. It's also about our personality structures, genetics, education, marital status, and family. We know that people's capacity for happiness is usually 50% genetic and then 50% the environment. We can't control the genetics, but we can control the environment. So just think of it as that way. Let's focus on what we can change and work on. One of the ones that I really love, and people, when I bring this up with patients, what I usually do is if I'm doing telehealth, I'll put that screen on and show them. Laughter therapy is kind of like yoga. It's a laughter yoga is another term for it. There are many groups that do this regularly. It can be very therapeutic, and I wrote in there about potential for diabetes. But if you look at the figure, it can reduce insomnia, respiratory functions, mental health, pain tolerance, and circulation, just to name a few. It can uplift your mood. And this is really simple. What it is even, you get in a group of people, you get by yourself, and when you're by yourself, what I usually tell my patients or my students is just put on that video of those little babies laughing and laugh with them. They're cute and you laugh with them 30 seconds a day. Just get that release and be able to do it. And it could be very helpful in your own state of resetting your positive state. There are many different action things, items that we can do that can help with our happiness. We're going to talk a little bit more about nature-based interventions later, but also you can talk about farming, green exercises, positive psychology and psychiatry, which we already talked about. Mindfulness and meditation is really important, not only for stress management, but for happiness and for our connectedness, and really coming to a place where you can build hope and hope in your future and hope in what you can imagine for yourself and your family going forward. Empathy and compassion. This is really important to me because I think it's not just about empathy with others and compassion to others. As Dr. Sugden mentioned, it's also our own self-empathy and our own self-compassion. This is vital for us to be able to engage in any sort of intervention that a clinician may give us. So if you don't understand how important this is, let me just state it now. If you're lacking in self-compassion or self-empathy, it's going to be hard. It's going to be really hard. And I know so many people that struggle and, metaphorically hit their head against the wall saying, I really want to do this and I can't do this. And they're not adherent to the recommendations. This is what they're missing. What we do know, it's not a woo-woo science. There's actually science behind it, and we can look at through these scans of brains and be able to say that there are regions of the brain where compassion and empathy lie. What that basically means is for those people that may be lacking in their empathy, or that we can actually do interventions to increase their compassion, we will find blood flow and different light regions of the brain light up differently. Huge. So now things that we knew in the past that how important they are, now we have brain scans that can actually correlate with that. Another major piece that I really think is important is this whole concept of social altruistic activity. So altruistic activity, which we all know is just giving to people, doing something, going to, food banks and giving serving food. But social altruistic activity is when you don't know the person, you don't even have any gratification from seeing them get what you're giving them, but still you're doing it. That in itself has been shown through brain scanning to actually be very important in preservation of brain matter, and it's very sensitive to age-related processing and cognitive decline. So when we're talking about our older adults or even talking about our younger adults, we're talking about actually preserving your brain function over time and across a lifespan with even something as simple as social altruistic activity. Touch is very important, and I know as clinicians we don't touch our patients, but this is about appropriate touch within families or couples. That we know that there can be, we can map them out in different regions of the brain, and there are multiple circuits that are overlapping neurobiological processes that go on with something as simple as touch. So when we move on to spirituality and religion, now again, this is not about me or you as a clinician telling your patient or your client, this is my bias and this is what I want to do. This is about knowing that 70 to 80% of the population consider themselves either spiritual and or religious. And what we really want to do is maybe do those 4 questions. I call them the FICA questions. And basically you're asking your patient, are you practicing a religion? Do you believe in a religion? Do you have a community where you're engaged with this? Is it something that's positive or negative in your life? And do you want to talk about this in the treatment? So those are 4 questions. You can ask those quickly, yes or no questions, and then be able to potentially help patients and engage with them in that level. It's very funny because clinically, when I see patients and I ask these questions, people will tell me, "Oh, I'm Jewish, I'm Islamic, I'm Hindu." Whatever they say, Christian, I have enough basic knowledge of knowing when someone says that's important, that's where I go within that treatment. Most people end up thinking that I'm their religion because I show curiosity. And when you show curiosity, then people feel like they want to engage, and that maybe help them move forward. We know that spirituality is very important in meaning making, and it's especially important when we talk about the spiritual development in adolescence. Through supportive social relationships and deeper reflections, adolescents can actually develop and grow their brain. Spiritual thinking is very important in growing the adolescent brain and more sophisticated and deeper levels of thinking. So even in adolescence, for those of you who are inclined to be spiritual or religious, taking your patients, your family members, your children, and helping them engage in that time will be really lifelong helpful for those people. We know that spirituality is very important in brain health. That's when you have a positive relationship with spirituality. For those that have a negative relationship, that's very different. That's why we include that question when we ask them. But it also can help with connecting brain circuits better, and therefore that is helping when you get older in cognitive development. And we know in those patients of ours that are struggling with serious illness or health, spirituality can be very important in helping them reach the quality of life that they want to. This is a JAMA publication that came out as a systematic review, really talking about let's help making sure when our patients are in the hospital or in treatment that we have a team that can support their spiritual needs if that's something that's important to them. So this is what I talked about earlier, the FICA inventory. What this basically is you ask people if they consider themselves, the F is if you have faith, do you have a belief system? Number I is it important to you? C is, do you have community? Is that supportive to you? Is that something you used to do in the past, not do it anymore? And yes or no, do you want to address this in care? Okay. And that's an easy way to remember these. You don't have to ask these exact questions, but if you do that when you first do the intake of the patient, note it in there, then over time that's available to you if you need it. Purpose in life and meaning making, which is our 4th domain. What I really want to do is just really go through this very quickly. Ikigai is that Japanese term for the reason for being. What we know that our purpose and meaning making are so important to us. I'll give you an example. My 93-year-old father, for the last 2-3 years, considered his purpose in life after he retired was taking care of my mother and making sure she had good care because she struggled with her health more than he did. And that was the reason he woke up every morning, because he needed something. He had a job where he knew exactly what he needed to do today. And now after retirement, he needed a purpose to wake up every morning. When my mother passed in February, he lost that purpose. And he lost that meaning of his life. So we needed to find more things for him that were purposeful and meaning making. And this was especially important for my father because clinicians could easily think that he got depressed. And maybe he was depressed. That's a separate issue. But this was also an issue. And we needed to address this as well, in addition to potential depression symptomatology. So we know that this could be protective against cognitive decline in addition to mental health issues and diagnoses. And we know that having a purpose in every demographic and race is actually noted to be helpful in their cognition over time. This is a beautiful study, and what this basically talked about is this rating scale called Life Purpose Score. And if you had a higher score in what you considered that you had a life purpose, your probability of survival would be higher in months. And this was really important to look at it. It's a meta-analysis. You might want to look at it. All the citations are on the bottom right there. Social connection, which is what we really had talked about this pillar before. We know that the Surgeon General in this white paper came out. It's hundreds of papers. It's freely available on the internet. Came out in 2023. You just Google for it, and then you'll find it and be able to download it. Basically, what they're saying in this, there's so many studies, so many citations saying that this is an epidemic. We need to address it. We know that these issues of social connection and low loneliness are impacting our health just as severe as obesity is. Just as severe as obesity, meaning we can't think, even though we can't touch it and feel it, and we don't have a BMI or anything to evaluate our loneliness or isolation, it is as equally as important to address. And what helps with this social connection? We know pets, music, eating together, exercising together, serving together, and there could be factors that help shape social connection. Dr. Sugden brought them up with the structure function, and then we can also look at them as an individual, relationships, community, and society. And relationships is where that structure, function, and quality of what we're looking at take effect, but also on the individual level, the community level, the societal level is very important. And this helps really point to the interconnection to all our domains of connectedness, but also our other pillars of lifestyle medicine and lifestyle psychiatry. And the last one I want to just touch on really quickly is nature. And this could be all of these, every slide that we have here could be an entirely another presentation. I usually talk and I joke when I start these presentations that I start with 20,000 slides and I have to pare them down. Okay, I didn't do 20,000 slides today, but really this is a field that is really full of data, and we need to really embrace that and understand that. And we can actually talk about that offline. You can absolutely reach Dr. Sugden and I. We will put resources in the end that you can reach us. But nature is the sixth domain that we're talking about. And basically, forest bathing is a Japanese tradition, bringing calmness and connectedness. And we don't all have the availability of going out in nature in the forest. Some of us live in urban, some of us live in areas that we can't, and some of us work during the day that we can't do that. And then we have responsibilities with families in the evening. You could create a little garden, create a little potted plant. And what they've even found in some of the data is that even if you, behind your computer, put a picture of landscape, of trees, put that behind your computer, and in between patients, if you're doing telehealth, or even in your office, put that there behind your computer, and then just look at that, gaze at that for a few seconds a day. There is some benefit to that, and you can also get the benefit of being in nature. It may not be exactly the same as if you go out there, but a little bit, and that over time can accumulate and be very helpful. So it reduces stress and anxiety, strengthening the immunity, lifts mood, improves sleep, boosts attention, and of course sparks your creativity. So that's a really quick review of connectedness. We have a handout at ACLM, and that's the Connected Handedness that's available for the members there as a resource available. If you go to this QR code and then you go there, you can also become a member of ACLM as well. We know And we really believe that it's very important to have a clinical community focus on treating the root cause of chronic diseases, thereby shaping the future of healthcare. And that's what ACLM does. As medical professionals, you can help shape the future and restore health to millions. Join us in our mission to reverse the chronic diseases crisis by empowering patients to choose healthier habits, rediscover what it means to build trusting patient relationships, and put the care back in healthcare. We are the only medical society dedicated solely to lifestyle medicine. Thank you so much for your attention. This QR code is to my website with freely available resources. If you go to the top and you see the resources and scroll down, there's websites, there's other links to other websites that are available. Make sure you check out this paper that Dr. Sugden and I wrote about the expanding pillar of lifestyle psychiatry, lifestyle medicine. Lifestylemedicine.org is our ACLM website. Thank you so much for your attention. If you want to reach us, please feel free to contact me at giamerlotmd@gmail.com. And Dr. Sugden?
SteveSugden5 at gmail.com.
We are there for you, and we are there to support you. Thank you so much.